Good morning.
Hey, good morning, KJ. This is Lewis over at ASU Health Services. Good morning.
How are you, Louis?
Good.
Okay, let's see here. So I think I have the presentation here. I can have you run it, or I can run it. The way I was told by Haley to do it is that we're going to talk about a little about our ISSC here in the beginning, assuming just some of the new students haven't been through our other webinars yet. So just a quick intro on ISSC and our team, and then I'm going to hand it over to you.
Okay. Sounds
And
good.
and I can actually run the slide, and you can, as
Just
as a team says, see you're done with talking with one slide, I'll just keep rolling. And if you need to go back or tell me to go forward, just let me know.
okay. That sounds good.
Okay. And then also, I'm going to tell them that there's a Q&A, and I will try to answer as much of the Q&A when you're doing your presentation, but I'm pretty sure that there are going to be many questions that I would not know the answer to. Then at the end of
Yeah.
our presentation, we can just go over that Q&A.
Yeah. And no worries. We have also Jessica Creed, my colleague, on here,
Oh, okay,
who
perfect.
who who can be answering questions via the chat as they come up or jump in at any time. So
Yeah, if she can click on the Q&A here, I don't see it here. Oh yeah, there it is. So there's a Q&A and it pops up. So I'm going to tell them that Jessica actually asked the question right away. Yeah, we'll do the questions in the Q&A instead of the chat, because I think the participants will not be able to have, they'll see the chat, but I don't think they can ask or they can type anything in the chat. So they'll have to type it in Q&A. And this way we can actually keep track of our questions answered and all that. Does that work, Jessica? Is that good? I'm assuming yes.
yep.
Okay. How are you guys this morning? Are you doing good?
Yeah, good. Not gonna lie, waking up still waking up. It's a little
Yeah,
early, you know. It's funny how when you break your routine even by like half an hour, it feels so different.
that is true. I was doing the first one we did was 7 a.m.
Yeah.
and I was like, let me answer Jessica's question here. And I was like, wow, 7 a.m. is early. And then it's funny too, because we had some students that joined us and they were like you could see they were just getting up. They're like,
Yeah,
oh,
yeah, yeah.
they just got out, they rolled out of bed and they're like, it was interesting. But yeah, you're
It
right.
never, it never, KJ, it never gets easier, man, to get up in the morning and get on the go.
Yeah, it's you're absolutely right. No matter how long we take. All right, let's see here. If I have a share screen capability here. Okay. Mhm. If I can, that's not it. But this is the first time I'm doing this today. I mean, this session, running the session. So let me just bear with me.
Yeah,
I figured
no
this out.
worries. We know there's always a few bugs to work out.
Okay. Actually, it looks like I may not be able to do the Q&A at all, because I will be running the screen here. So I think Jessica is there, and it's going to, most of the questions will be related to health insurance. And then what we'll do is, once we are done with the presentation, I'll ask you, Jessica, or I'll ask Louise if you want to open the Q&A. If you see any questions that you cannot answer, just ask me and I'll answer them.
Okay, sounds good.
Yes, it looks like we have 25 participants here. A couple of minutes, I'll start the see if I can just make sure. Do you have the button for the start webinar, Luis?
Start webinar.
Do you have that option? Can you do that or no?
At the beginning, when I first logged in, it did.
But not anymore.
Not anymore. Now I just have like the button on the bottom right hand corner says end.
Oh, I wonder if they already started it. Okay, looks like we are already live on the air. Hello, everyone. Thank you for joining us. If somebody can please put a if somebody can please put a quick note in the Q&A saying that you can see our presentation so we know if we are live or not, because we're having some issues to see if we are live. Okay, they are ready. So, okay, so sorry, let's do that.
Also, KJ, can they hear us? Can they hear both of us?
Yes. Can you please type if you can hear us? I think so they can, because that's what I was talking and they responded to it.
Okay.
Okay. All right, hello everyone, welcome to our ASU Health Services webinar today. We're going to be talking about a little bit about ISSC, and then we're going to be talking about the purpose of this pre-arrival webinar, and then I'll have my colleague Luis here take over and talk about ASU Health Services. So that's our agenda for today. I do ask you that if you have any questions, please put them in the Q&A. We have our colleague Jessica there answering those questions, and then for all those questions that she can't get to, we'll get towards the end of the session. Also, if you have any specific healthcare questions, please hold off on those until we get towards later in the presentation, because we might be talking about them. So they'll be part of the later on, and towards the end of the presentation, we'll have a general Q&A for you. Some of you may have attended our earlier webinars, so some of the information may be repeated to you. We just want to make sure that those who didn't get that information, so a quick ISSC introduction, we'll start with that. So let me go ahead. Let me start with our International Graduate Student Initiatives team here at ISSC. My name is KJ, I'm the coordinator here. And I work in the team for Haley Cosano. She's our assistant director. And we do have 2 student workers right now, and we ought to be getting more student workers. So this is our team that is dedicated to all the graduate international students to help support you with everything that you need here at ASU. If you have any questions after the presentation, or if you have any general questions, you can always email me or Haley, or just issc@asu.edu. I also want to let you know that we will be recording this, and we will be posting this on our YouTube channel later on, which our tech team will do, and we'll send you a link for that. I will also be sending everyone a copy of this presentation, so you'll have all this information available to you later on in case you missed on taking the notes. We also have a GPM, Global Peer Mentors team that helps you with all your questions. These are students who they're student workers hired to help you with your new life here at ASU. When you get here, you will get an email from your designated GPM. Please make sure you respond to them because they are a great resource for you to use for all the information that you have here at ASU. Other than our team at ISSC, we have other support teams that support our students, international students. There's the Indian student team. There's the Southeast and East Asian student team, the sponsored team. And if you don't know what sponsored team is, if you're not a sponsor, then you don't have to worry about that. For those who are sponsored students, they know that they are sponsored students, and then there's a team dedicated for them. There's the Middle East and North Africa region, the MENA team, and Fulton School of Engineering, the Polytech campus, and finally, of course, the advising team that'll help you with all your immigration questions and answers. This is what ISSC looks like. Some faces may have changed, moved on to bigger and better things, but this is mostly us, all of us, about more than 35 to 40 staff members and even more student workers always here to help you. The front of our ISSC, that's what it looks like. We have students coming from 158 countries around the world. Our Tempe campus, we are located in Student Services building. We also have offices in other campuses, and I'll get to that in a second. To contact ISSC, the best way to do that is issc@asu.edu, and we respond to emails very, very fast. So if you have any questions, please email us. You can always call us as well. The offices, other campuses, we have a office in downtown Phoenix campus, the Polytech campus, and the West campus. And I'm breezing through this because we have already done these shares in earlier presentations, so it's kind of just a recap. Important reminders for you: the request for request your I-20 is good. The deadline is tomorrow. Mandatory CUS check-in, which is when you do when you enter US, will be starting from December 14th, and you should be able to finish your check-in, CUS check-in before the school starts, which means they should be here in the US before school starts. Other deadlines: immunization deadline and enrollment deposit and registration for classes. The best resource for you to know about everything that you need to know as a student at ASU is to check our ISSC website. That is a great resource for you. So please go ahead and make sure you do that whenever you get a chance. And of course, you should follow us on social media. We're on Facebook and Twitter and Instagram. A lot of fun things going on Instagram, by the way. And now I'm going to hand it over to Luis, and he's going to talk about student health insurance team. He'll talk about ASU Health Services with you. Thank you.
Yeah, so good morning. We want to thank KJ and the ISSC for allowing us to present this morning, give some very important information. We want to welcome all our international students to the spring 25 semester. This is always an exciting time, not only for you, the student, but also us staff here at ASU. And again, we look forward to not only providing information today, but also we're going to be available throughout the semester and throughout your time here at ASU. So again, this is going to be a complicated subject we talk about. We're going to try to simplify it as much as possible. But again, if you don't capture everything, we're going to give our contact information and other resources that you'll be able to reach us throughout the semester. So our student health insurance team in particular is made up of myself. My name is Luis Galaz. We have Jessica Creed, who's going to be answering questions and answers via that system there. We have our referrals coordinator, Kristen Hansen, who always works with our international students as well. And then we have our student outreach coordinator, student worker, which is Isaiah Galaz. So you'll be seeing us hopefully quite a few times throughout the semester in your time here at ASU. Our email information is insurance@asu.edu, and our phone number is listed. But we will get into it. Everyone's going to have a patient portal, and that's where we're going to really be available to answer your questions, and that's going to be a secure way for you to contact us, and that's going to be the fastest response time is through your patient portal. But we'll get into that in a few minutes. So if KJ, we can move on to the next slide. Yeah, so frequently asked questions. This is going to be one of the most important subjects that we believe is going to be relevant to our international students. Not only is it very, very important, but it's also one of the things that is least understood or least asked about, because we get a lot of students that, for the most part, are coming in that are on the younger side, or maybe in some cases not so younger, but are healthy, okay, are healthy and maybe don't go to the medical provider too often in your home country. But here in the United States, things are a lot different. So we're going to cover some of the most basic questions that we hear every semester from international students coming in for the first time. First things first is, who's my insurance company? Once you figure that out, will I get an insurance card? Okay, an insurance card to identify myself with my insurance company. How much do services cost, if there is a cost? Where do I receive medical services and counseling? Where do I begin? Where would I start? Are telemedicine visits available, or do I have to go in person? How would I schedule a medical appointment? Or how would I schedule an appointment to be seen by a counselor? Okay. And who can I contact if needed and if I need assistance? So these are all really basic questions that everybody usually asks every semester, and they're good questions and they're basic. And that's what we want to really use this presentation and this workshop for this morning, is just to equip you with the most basic information. And hopefully from there, it'll point you in the right direction and kind of get you started on navigating healthcare and the healthcare system here in the US. Now, with that being said, healthcare system in the US is very different than most countries around the world. For the most part, we get a lot of feedback, and a lot of students in their home country maybe have national healthcare, and also maybe they just have one facility that they go to for all their medical care needs, whether they go to that one facility for a cold, for an injury, for a surgery, or what have you. A lot of students are giving us feedback that in your home country, there's not really much to pay. It's not very complicated, and you usually may go to one facility for most, if not all, your healthcare needs. But here in the United States, it's going to be a lot different, and that's what we're going to get into in just a few minutes. But also, here in the US, if you haven't heard, which I believe most students have heard coming into the US, is that the US healthcare system is very, very expensive. And without the proper health insurance plan or coverage, it would really be unaffordable. Not only for international students, but this holds true for citizens and anybody else here in the US. Now, health insurance does require individuals to pay some out-of-pocket costs for services. So although the university has done a fantastic job at getting you one of the best insurance plans that you could probably have in the US, and it minimizes how much you would pay out of your pocket, you're still going to have to be responsible for paying some things out of your pocket when you use the insurance. And again, we'll go into those details in just a few minutes. Another thing, again, we just started off with your basics this morning, but it's going to be very, very important for you to review your health plan policy and know other basic guidelines. Again, and if you're not sure, then we're going to let you know who you can contact, whether it's the insurance company directly, who is responsible for payment of your medical bills. It might be us, the Health Service Center here on campus, to help you navigate or connect you to the right place. And throughout the semester, we're going to be having other workshops and question and answer sessions, again, to help you become even more familiar and more comfortable with your insurance plan. We can move on to the next slide. Now, the student health insurance, the name of the health insurance is United Healthcare Student Resources. United Healthcare is the largest insurance company here in the US, but your particular plan is called United Healthcare Student Resources. Okay, it's going to be very important for you to remember the name of the plan. And the reason you have this student plan, it's going to be to provide coverage for when you're sick, if you have an injury, and it also covers something for preventive care. For example, any vaccinations you may need are going to be covered as well. Also, if you just need a checkup, there is no injury or sickness, you can get a preventive checkup, okay, with this insurance plan. And one of the other major reasons people have insurance and just require that you have insurance in the US is because it's going to protect you from very, very high medical bills. The situation is so extreme that one medical bill can really put you in a really tough situation. So it's going to be so important, again, to learn about your insurance plan, learn where to go, how to use it, so that you avoid any high and very expensive medical bills. Again, this is a top tiered, one of the best insurance plans that you can probably have in the US. We do some comparison with other universities and, just comparing to other insurance plans that come through our office. And we can really feel assured telling you that this is one of the best top-tiered health insurance policies you could probably have. And again, ASU and the Arizona Board of Regents has done a great deal at negotiating the best possible value that they can get for our international students. Now, Spring 25 early arrival coverage began yesterday. It began on December 4th, and it will go all the way through spring and summer to end on August 15th. The price that will be put on your student account is $1,931. Now, these coverage periods and dates and pricing cannot be changed. This is required for all international students that are on an F1J1 visa. If you're an approved sponsored student, you'll know if you're an approved sponsored student and your sponsor is paying for your tuition and your insurance. And in that case, once Student Business Services Financial Department gets your financial guarantee, they'll go ahead and waive the insurance because you fall into a special category. If you're not an approved sponsored student, then again, as KJ mentioned earlier, then it's probably something that you're probably not if you're not aware of it at this point. Now, this will be automatically applied to your account each semester. And what I mean by each semester, it's fall and spring. Spring includes summer. So it's only going to be fall and spring. Again, spring automatically includes the summer. And just to be clear, the student health insurance policy is not on the calendar year. It's close to the school year, the academic year. And the actual policy begins on August 16th of every year and ends on August 15th of every year. And then it begins again on August 16th. Now, there is a dental discount program available through United Healthcare Student Resources. We can give you more details on that a little bit later. But if you're under the age of 19, if you are under the age of 19, the medical insurance plan will cover dental and vision services for you. If you're 19 and over, dental and vision is not covered, except for a few exceptions. And we can go into that a little bit later.
Just a quick interjection here, Luis.
Yeah.
I saw some students raising their hands. Please put your questions in the Q&A and we will answer them in the Q&A itself. If we don't answer you in the Q&A, we'll answer it in the part of our presentation, and just wait for it, then we get to the particular slide. But please put the questions in the Q&A. Thank you.
Yeah, again, so from this slide, key points are the name of your plan is United Healthcare Student Resources. You have this as an ASU international student here in the US. Your coverage began on December 4th. It goes through August 15th. So it includes the spring and the summer. It is required, okay? And it's automatically applied to your account each semester. Okay, so please keep that in mind. We can move on to the next slide, KJ. Where do I go for care? This is probably one of the most important slides and information. So this is really, really important. We talked about that the US healthcare system is a lot different, and it might be a little bit more complicated than in your home country. So we're going to identify where you would go for care for different types of services or different types of needs. Okay, and again, this is just a basic idea so you can start understanding how this is going to work. So as an international student and as a student on this student health plan, your first stop is going to be ASU Health Services and ASU Counseling on campus. Okay, so this really makes it easy and convenient. So we call this your primary care. All your care starts here on campus at the health center, the medical center. People refer to it at different, in different ways, but again, it starts here on campus. We do have an after-hours medical advice hotline, so that if after hours you need to speak to a medical provider, you can call our general number and you'll be connected to a live person who can give you medical advice. Okay, you're not sure what to do or where to go. It's not an emergency, but you want to talk to somebody, you'll have that after hours medical advice number available to you. Now, campus providers, excuse me. If you need something off campus, and this usually means a specialist, say a specialist or some type of radiology or some type of special service that we can't provide, or our provider feels it's better if you go off campus, you do need a referral first before you go off campus. Okay, so if you needed to go see a specialist, let's say a heart specialist, a dermatologist, you need an MRI or something of that nature, you still need to do your first stop at the health center. The health center provider will go ahead and determine if in fact you do need to go off campus, and then they'll write a referral, which pretty much gives you permission to go off campus to that specialist. Now, we have another place off campus that you might not have heard of before. It's called urgent care. Urgent care clinics are available off campus. Urgent care clinics are not the same as an emergency, a life-threatening emergency. But you know what? It's a situation that can't wait. And urgent care clinics off campus, a lot of times are open later than the health center. They might be open on weekends and even on holidays, and it depends on that urgent care. So if you need to go to an urgent care because maybe the health center is closed, or maybe you can't get an appointment the next day and you can't wait 2 days for an appointment, and that happens in some cases, then the next stop or your next place we would recommend you go is urgent care. Okay? And again, this is not for a life-threatening emergency, but it is for something that can't wait a day or two. Now we move over into going to the emergency care. Emergency rooms are usually located at hospitals here in the US. So if you do have a life-threatening emergency, and this holds true to regardless of whether you're on campus or off campus, you would dial 911 so the ambulance can come pick you up, okay? Or you would go to the nearest hospital emergency room. Now, again, this is much different than urgent care. Emergencies are more on the life-threatening or very severe situation where you cannot wait. You need attention, and you need that attention now. Okay. Now, referrals are not required. This is a very important distinction. Referrals are not required for urgent care visits or emergency room visits. However, if the urgent care office or the emergency room hospital issues you referrals, those are not valid. You need to come back to the health center and get it issued by the health center. So again, as you can see, you're going to have to learn how to navigate. You're going to have to ask questions at times, and you're going to see that it's a lot different. And again, you might not remember this, but we're going to have not only this slideshow available to you, but we're going to have workshops available to you throughout the semester. And we're also going to have other questions and answers. And we're also going to be sending you this detailed information via your health portal. So you can access as reference to this information through your health portal. And we'll get into that in a few slides. And one other thing on this last slide is that you do, when you go off campus at any time, you do have to use providers that are in your plan's network. United Healthcare Student Resources has their own network of doctors that they are contracted with, that they work with, that they do business with. We have to be clear that not all doctors, not all hospitals, not all specialists, not all urgent cares work or are contracted with United Healthcare Student Resources Network. So if you were to go to a provider that's not contracted, the health insurance company will not pay your bill. Also, if you do not get a referral when it's required, the health insurance company will not pay your bill. So these guidelines and these rules are super, super important. But again, this is just a basic introduction. We'll be able to assist you throughout the semester. Now, how much do services cost? On campus here at ASU Health Services, you only have two fees. One is for visits, which are $15, and one is for labs and x-rays, which is $10. Okay, these fees will be billed to your ASU student account probably within about a week after you visit the health center. Okay, this is not going to be charged or billed to you, or we're not going to collect payment at the time of your visit. So that should not be a concern. It will just be added to your ASU finance account within about a week. And then you owe that $15 or those $10 to the university. Again, these are the only two fees you should have on campus. If you do end up going to counseling services on campus, there is no fee. Counseling services on campus are at no cost to all our students. So keep that in mind as well. Now, off campus, if you go off campus, again, in most cases, you will need a referral, okay, unless you're going to urgent care, the emergency room. But off campus with a referral to a specialist visit or any other type of visit, it would be $25. And that $25 would go to that medical provider you're seeing off campus. These off-campus fees are not charged to your student account. So again, if you have questions about payment, whether they charge you at the time of the visit, or they're going to bill you after, or send you a billing statement via your email, that's something you have to talk to about that off-campus provider and be clear on how you're going to pay that money to them. If you go to an in-network urgent care, that's $25. Emergency room visits are $200. If you have to be hospitalized, you need a surgery or some type of special procedure, you will pay the first $250 of the cost, plus an additional 20% of the bill. The insurance company, United Healthcare Student Resources, will pay the other 80% of that bill. Now, this, again, sounds like a lot of money, but in just a couple of, in just a minute, I'm gonna kind of give you like the most important detail about this entire slide about paying things out of your pocket. Prescriptions. Prescriptions are something that the doctor orders or writes. Okay, if the doctor writes a prescription, most prescriptions are covered by the insurance plan, not all of them. There's thousands and thousands and thousands of different prescriptions available. And again, your insurance company will cover most of them, but not all of them. But a prescription is something that the doctor writes that you have to take to the pharmacy, that the pharmacy has to dispense to you. If you go buy a medication or, say, for example, aspirin or something that you do not need a doctor's prescription, that is not included in this category. But with prescriptions, you pay the first $125 of the cost of the prescription. And then after you meet that $125, your prescription will fall into a category, category 1, category 2, category 3. And at that point, category 1 prescriptions are $15, category 2 prescriptions are $40, and category 3 prescriptions are $80. Okay. And again, there's a cost that you're going to have to incur for using your insurance. But again, this next bullet point kind of brings the point home of the whole reason you have insurance in the first place. So maximum out of pocket. The maximum out of pocket is the term used in reference to protecting you, the member of the insurance plan. This maximum out of pocket under this plan for the entire school year, fall, spring, and summer, protects you, the student, at not paying more than $1,500 for any healthcare you may need that's covered under this plan. Okay, that's assuming that you're going to in-network providers, you're getting referrals, and the services are in fact covered by the insurance plan. So to kind of put it all together, whether you go to a visit here at the health center and you pay $15, if you go to urgent care during the semester and you pay $25, if you go to the emergency room and pay $200, if you need a hospitalization, you need to be in the hospital for 3 days and need prescriptions. All of these things that you're paying, once they add up to $1,500 in any point of the school year, at that point, moving forward, you will no longer need to pay for any of your healthcare for the rest of that school year. So again, this $1,500 is a lot of money, and it sounds like a lot of money, and understand, but here in the US, this is probably the best protection you can possibly have. And again, we review other insurance policies from other universities and other insurance policies that come across our department from students all over the country. And I can be very confident that this is one of the best policies you can have. And again, anything on campus will be billed to your student account. Anything off campus will be billed by that provider, and you make sure you know how to pay that provider off campus. Again, United Healthcare Student Resources. Again, I cannot stress enough to add the student resources, because again, United Healthcare has a lot of different companies and a lot of different plans throughout the US. They are the largest insurance company. However, yours is United Healthcare Student Resources. You will have to go to their website, okay? And you might be able to do this today. If not, by tomorrow, you should be able to go to their website, and you're gonna log in, and you're gonna first register. Before you sign in, you must first register, create an account, okay? Once you create an account, then you'll be able to actually sign in. And this is gonna be your go-to for all your insurance plan details, information, resources. You're gonna be able to print and access your insurance ID card from here. It will not be mailed, so you have to create the account. You'll be able to find in-network providers. You'll be able to find what prescriptions are covered. You'll be able to pretty much do everything and anything related to your insurance company. You can also send them messages, and they'll be sending you messages. So throughout your time here at ASU, I'm going to strongly encourage you to check your account periodically, maybe once a month or a couple times a semester, because the insurance company will also send you very important alerts and messages that you must respond to. And in some cases, if you don't respond to them, they will not pay any medical bills. So please make sure you get familiar and comfortable with your account. Now, ASU Health Services, our main campus is here in Tempe. We're located off University Bridge and Palm Walk on the south side. Okay, our address is there, our phone number is there. But just in a minute, we're going to highlight our patient portal. So you can reach us here or come to an appointment here. You can come to the downtown campus if you're in the downtown area, the Poly campus for those of you on the Poly campus, and also the West campus. So you have access to any health center on any of our campuses with this student plan and as a student. Now, ASU Health Services, we're pretty much a comprehensive health center. This is why it is required that you start your primary care and your first stop be at the health center, because most things that you're going to need throughout your time at ASU, I would go as far as say is 95% of things that you may need for most students are going to be accessible on campus. So again, it's easy to access to high quality care. We have board certified physicians and nurse practitioners. We do primary care. Okay, and primary care is again, like if you're sick or you're injured, but we also do preventive care. We have providers that specialize in women's health. Okay, that's very important. Here in Tempe, we do labs and x-rays, so you don't have to go off campus and find transportation for basic stuff like that. We do immunizations or vaccinations. We do sports medicine. And we also do telemedicine in some cases as well. Now, scheduling appointments. Okay, everyone that's enrolled at ASU, including our international students, have a patient portal. Your patient portal is accessible through your My ASU account. Now, this is going to be your portal for all your care here at the health center and the counseling center. And again, this is going to be how you set up appointments. This is how you can send a message to the student health insurance department or to the referrals department or to the appointment department or whatever department we have. Your online patient portal is going to be your go-to. Okay, it's secure. One of the important things here in the US and we take very seriously is your information because it's in a medical federally protected environment. We are recommending and strongly encouraging everybody to go to your portal to talk about anything related to your healthcare. And again, this is how we'll respond to you as well, is through your portal. You can also call us, but in all honesty, when you call us, you may go through a phone tree. And at times, a lot of times the phones are busy. So again, the best way to reach us or to set up appointments or to get the information you need is going to be through your patient portal. And not only is it how you reach us, it's how we're going to reach you. We have so many students that we send out notices to with very important, helpful information about healthcare and about services and really about anything related to ASU Health Services. We do invitations to workshops. We do invitations to questions and answer session. And it's unfortunate that we have so many students let us know that they're not checking their messages on their My Health patient portal. So again, take a minute to check your patient portal a couple times a month, just to make sure there's not something there that you need to respond to or that something there that may be helpful to you. Now, information and assistance. Again, this is where we're going to recommend you spend a little bit of time. Please visit our website at eos.asu.edu/health. Take 5 to 10 minutes to go through the website, click through it. You'll kind of confirm and give you more details and additional information of what I spoke on regarding ASU Health Services and perhaps the student insurance. Our student health insurance department is also, again, we're referring you back to your patient portal. Okay. United Healthcare Student Resources website where you have to go and register to create an account, and then you'll be able to sign in. When you register your account, you're going to be using your name exactly as it is here at ASU in your registration. You'll be using your date of birth and your 10-digit ASU ID number to create your account. Okay, so please try that. If it's not available today, please try in the next couple days and it should be available. Also, please take a minute to go to ASU Counseling and visit their website. Remember, all visits to ASU Counseling on campus are at no cost. If they feel you need to be seen off campus because you have the student insurance, they'll provide you a referral for additional services off campus. But the initial visit to counseling is at no cost to all our students. And then we have an Impact 24-hour dedicated crisis hotline. If you need to speak to a counselor, okay, you can call them. And then there's also what we call Open Call, Open Chat. It's an app and a service that you can visit that website, and you'll be able to contact and speak with a counselor or somebody, not only 24 hours a day, but 7 days a week, but from anywhere in the world. And that's a special feature that Counseling Services has set up for all our students. So again, these are very, very important resources. They may not come up often, or maybe they will, but even if they don't, when they do come up, they're critical in knowing how to go about getting the services you need and how to navigate healthcare here on campus in the US and off campus as well. Now, again, I can't stress enough, we're continuing to work tremendously with the International Student Scholar Center, KJ and the rest of his team throughout the semester. The fall semester was the first semester that we actually collaborated. It went very well, and we're continuing to build on those wins that we had and those successes we had in reaching out to our international students. So again, you'll be getting notifications from various sources through the ISSC, through your graduate department, through your patient portal, on informative events throughout the semester. And again, they come in the form of workshops where we focus more specific on certain areas of your insurance and healthcare. More details are provided. We have Zoom webinars. We have walkthroughs. We have in-person and Zoom events as well, and questions and answers sessions. And again, my name is Luis Galaz. Jessica Creed has been answering messages through the Q&A chat place. We have Kristen and Isaiah Galaz, who will be serving you and here for you throughout the semester. Again, we thank you for this opportunity to be here. Again, I cannot stress enough how important health insurance, knowing where to go for your health care, referrals, staying in the network, and all these other guidelines that the insurance company requires for you to avoid any very expensive medical bills. So with that being said, KJ, I don't know if I have any other slides, but if not, I don't know if you want to jump in and maybe throw some questions out.
Sure. Thank you, Luis. And I did want to add a few things, and Luis, please correct me if that is not that information is not correct anymore. I first want to let everyone know here that in the US, your medical information, your medical history is very protected. You do not have to share that with anyone. No one should be asking you except your healthcare provider about what's going on with your health. So keep that in mind. So, and that's important because if you ever are late for school or late for class for some reason, you don't have to give your details about your medical condition and all that. So I wanted to throw that out there. That's very important for our international students to know. Second thing I also want to clarify is that when you do call for an ambulance, when you dial 911, there should not be a charge for the ambulance itself. Is that correct, Luis?
Yeah, so your policy, most plans do require payment or a partial payment for an ambulance. But under this policy, again, it's a great policy. You should not be charged for the ambulance. Again, I want to be clear. Things are somewhat complicated here in the US. You would be calling 911 or going to the emergency room in an emergency situation. Now, if it's determined that, you called 911, and it wasn't really didn't rise to that level, it wasn't that severe and it didn't rise to that occasion, it might not be covered, because, it's not really an emergency, you were cooking and maybe you sliced your finger, slightly, and it's bleeding a little bit. And, like for you, it's an emergency, but, you're going to dial 911. That might not be considered an emergency in that case. But yeah, the ambulances are covered under emergency situations.
Yes, and that can get a little complicated. And I'm going to share a quick a story that I've seen that I've heard from students, just to differentiate between real ER calling ambulance and not calling ambulance. I have one student who fell and thought that they may have fractured their leg, but they were walking around fine. They went home at night and they called their parents, and the parents had to call 911. And that was probably not necessarily because they were walking fine. There was not an emergency. They could have taken some pain medication and went to the urgent care the next day. And in another instance, I had a student who fell over the scooter and was bleeding out and decided not to call 911 and waited for their friend to come over. And that is actually a real emergency. If you are at the side of the road in the middle of the day or at night and you are injured, you need to call 911. So those are some basic examples, and there's more that we can talk about later. Okay, thank you, Luis. I am going to see the Q&A and see what most of our students are asking and see if we can answer any of them. There is a question about if they can have some other coverage plan which is cheaper than what they're paying right now. If you want to address that.
Yeah, that's a question we get answered every asked every semester. Unfortunately, the answer is no. Reason being is that this has been really thought out and really planned out for our students. And this is the same policy that domestic students and international students have. It's the same policy here at ASU. Other universities work differently, but again, it meets all the requirements. ASU's threshold is higher than the State Department's threshold. The State Department's threshold is very low. To be honest with you, I can't believe it's so low to be in the US. But again, yeah, that's not an option. The only option would be if you were in a very special circumstance where maybe you have a US-based employer health insurance, that meets or exceeds the student health insurance policy, which is really almost impossible, then you can request a waiver. We could review it. But if not, please do not go searching for another insurance policy to buy it and then request a waiver, because if we don't waive it, you're going to get caught paying for both insurance policies. And that's happened in the past, where students bought an off-campus insurance policy that's cheaper, less coverage, doesn't meet these standards, and then they end up paying for both insurance policies. Okay, so again, unfortunately, the answer is no.
Yeah, and I can definitely attest to that this is actually a very, very economical policy. I think as staff members, we actually pay more than what you pay here. Okay, another question is about prescriptions. And the question is why the prescriptions are $125. I think we need a little clarification on that as to what $125 means and what the co-pays are.
Yeah, so again, we talked about there's hundreds, if not thousands, of different prescriptions that the insurance company pays for or is on the list of coverage. Some of those prescriptions here in the US might be $10 or $5. Some of them are thousands of dollars per pill. So, there's a big variance on, the lowest costing medications and the highest costing medications. So again, the way the insurance company kind of distributes the cost and help, pay for all these prescriptions for different situations and different needs is by having you, the student, offset some of the cost, pay some of it. And the way it works is, let's say, for example, and this is, I know it's complicated, but this is kind of the simplest example that I use. So let's say you come to the doctor, they write a prescription, and that particular prescription cost $125 at regular price, just regular price. That prescription, you go fill it, and it's $125. And let's say it falls into tier level 1, category 1, which would be $15. So you get here to the United States, your first month here, you get this prescription, you go get it filled, you take your insurance card to the pharmacy, and they say, okay, it's going to be $125. You pay that $125 that first time. the insurance company is going to keep track that you paid that $125 when you went to the pharmacy. That's why you have to show your insurance card everywhere you go, because it's a record of not only who the doctor or the pharmacy is going to pay or who's going to pay them and who to bill, but it keeps track of how much you're paying out of your pocket. So now with this prescription, you pay $125. You go back the next month because you only have a 30-day supply. You go back next month to fill that same prescription because you've paid already the first $125. Now you're going to fall into that $15 copayment. Okay. And then the next month, you'll fall into that $15 copayment. And for the rest of the year, you'll fall into that $15 copayment. So again, that's kind of how it works. And that's kind of like the simplest, easiest example I can give you. Remember, not only your prescriptions, but your cost of your co-payments for your office visits, for any labs that you might need, any hospitalization, any special procedures, all of this is adding up. That's why you got to keep track of your own records as well, because once it gets to $1,500, you're going to be good for the rest of that school year. Okay, and that's just one example. Let me give you another example to actually KJ could probably confirm this as well. This is a more realistic scenario. If you go to the emergency room because you fell off your scooter, okay, the health center's closed, and you go to the emergency room, and depending on what your injuries are, that bill can be between $3,000 and $10,000 for going to the emergency room for an hour or two. Okay, you would only pay $200 with your insurance plan. Okay, but realistically, an emergency room visit can be like $3,000 to $10,000 easy. And if you were to break your leg or have a serious injury, all the follow-up care that you would have to go to specialist, maybe surgery, can end up in the tens and thousands of dollars. And if you get a referral from the health center and go to specialists, your visits are only $25. If you needed a surgery, the max you would pay is $1,500 or less if you already paid other things. Okay.
That's a great point. Thank you, Luis. I have another question here, a great question. Does the insurance cover only the state of Arizona? If I get injured outside the state, will the insurance cover me?
That's an excellent question. So your coverage covers you anywhere in the US. Okay, so you have nationwide coverage in the US. And that brings up a very good point. When you travel and you're more than 50 miles beyond ASU, you're traveling to Northern Arizona, Southern Arizona, Los Angeles, Las Vegas, New York, Texas, wherever you're going, when you go beyond 50 miles of ASU, you no longer need a referral from the health center, and you don't need to check in at that point. But what you do need to do is you need to get into your United account or call them, because the customer service number will be on the front of your insurance card, to find in-network providers wherever you're at. So if you're in Los Angeles, you don't need to call the health center, but you need to call the United or go onto your app, put in your location, and it'll tell you what doctors, what urgent cares, what hospitals, what labs, what specialists in the Los Angeles area are in the network and that you can go to. Now, when you get back to ASU and you're within 50 miles, then you would touch base with our medical provider to get referrals if needed.
Thank you for that. And just to clarify, the emergency, the ER, if you have an emergency anywhere in the United States, you can call 911 and get treated.
That's correct.
I have another question here, Luis. Does it work outside USA?
Yeah, so there is a travel component built into it. Once you go into your account, create your account, there's going to be a section in there that talks about global traveling, okay, and coverage. And also on the back of your insurance card, on the front, you're going to have some details, your ID number, customer service, and some other important details. But when you flip the card to the backside, you're going to have the Global Health Center that you can call. And that's who you would call if you're going on a trip outside of the US. And you would have to contact them in order to get services paid. If you try to find healthcare or go to your own places outside of the country and do not contact them first, they will not help cover those costs.
You mean contact United Healthcare, right?
Yeah, there's a global number on the back, so when you're out of the country.
Perfect.
Mhm.
Question here is, what if you need to visit ER due to dental injury? Would it be covered by my insurance?
Yeah, so for dental injuries, like, yeah, if you have an accident, it's an injury that happens often, when students, again, are on a scooter, they fall and, they break their front teeth off, or there's an accident or something of that nature, or they're playing basketball and get an elbow to their teeth. Yeah, if you go to the emergency room, that would be covered. Now, the care after that, you can call the insurance company to see, because that would fall into a special category to see if they would help with the aftercare.
Thank you. I do have a question here regarding prescriptions bringing from home. So I wanted to just see if I can answer that quickly. And Luis, you can correct me if there's anything else to it. But if you are taking regular prescriptions at home, you can come and see ASU Health Services here and talk to the doctor, and the doctor or the healthcare provider will determine if you continue to need them, and they will issue your prescriptions, and then you can go to the pharmacy and get it done. Is that correct?
Yeah, that's correct. So one of the things, if you, and again, if you're have a medical condition or are taking ongoing prescriptions, we would suggest that you try to set up an appointment at the health center as soon as possible to discuss your medical condition and to get those prescriptions reviewed. A lot of times, the providers can write those prescriptions, if needed. But again, in some cases, the prescriptions might not be exactly the same, but our providers are experts in that, and they could provide something equivalent and very similar.
Perfect. Another question here is, does the insurance cover medical supplies for chronic illnesses like diabetes or hypertension?
Yeah, so it covers that. Again, you would touch base with your medical provider here. They have to write, they're not called referrals, they're called orders. And again, depending on the type of medical equipment, you might pay something out of pocket, but the majority of it's going to be covered under the insurance plan.
Perfect. Another question here is, I recently got my LASIK surgery done. I just want to know, in case I encountered some issues there in the US, would it be covered through my health insurance?
Yeah, LASIK surgery, again, I'm not a medical provider, but if it's medically related, there's you need medical care, yeah, you would come see a medical provider here. And if they need to refer you to an ophthalmologist, yeah, that would be covered. Now, if the LASIK surgery needs to be redone, I'm not sure if that procedure would actually be covered. But yeah, the medical care to be, checked and seen, obviously, yeah, that's covered.
And a couple of questions there you may have answered in the past, but we'll just answer it quickly. Somebody tried to go into the United portal and said they told them that they don't have access to the portal.
Okay, and they were trying to register?
It says UHCSR portal. Yes.
Okay, so yeah, again, if it's the United Healthcare Student Resources, I want to just be clear, United Healthcare Student Resources portal, the file did go over yesterday when coverage began. We're not sure. This is first thing here in the morning that we're doing, and we believe there might be a delay in uploading the files. So if you can't do it today, please try again tomorrow. If not, portal message us and let us know.
Yeah. One more question here is, I'm arriving on December 15th, planning to pay the fee in January. Will I still be insured on from December 15th?
Yeah, so you're insured as of now, whether the fee is paid or not. Okay. Our concern is not, our concern on our end is to make sure your insurance is good, you're educated on how to use it, where to go for services and stuff. But once it's on your account, then you owe the university that fee. But yeah, whether it's paid or not, we've enrolled you and we're processing and you're good to go.
Perfect. I have a question here. Do you have any suggestions for insurance plan, including dental and vision? And also, is United Healthcare accepted at all major hospitals?
Again, the the United Healthcare Student Resources Network is probably one of the most extensive networks in the US. But again, with that being said, it's not accepted at every single hospital or every single doctor's office or provider or lab or anything like that. There is no insurance company that I'm aware of that's accepted in every single facility. So it might be that there might be 5 hospitals around in your area where you live when you arrive here in the US. There might be 5 hospitals. And I'm confident that the insurance company that you're on will probably be contracted with maybe 3 or 4 of them, but maybe one of them it wouldn't be. And you don't want to go to the one that it wouldn't be. So if there's other 3 or 4 hospitals in the area, it just takes a minute to find out which one is in the network. And what was the other question, KJ?
I think they wanted to know about getting dental and vision coverage.
Yeah. So there's a dental and vision discount plan. And when you go to United Healthcare Student Resources website, ASU website, just their landing page, their homepage, if you scroll to the bottom, on the right-hand side, there'll be some dental information, and you can purchase a dental discount for vision and dental. And I think it's $20 for the school year, and it gives you discounts to local dentists, but that would be through a third party, and you would sign up through their link. But all the details are on that website.
Perfect. And I think we'll do one more question here. I think this is important that we cover it. Over-the-counter medications, and I'll talk about it just quickly a little bit. Anything that is not prescription is over-the-counter medication, which you don't need to see a pharmacist. You can just go and buy it. That is usually not covered per your insurance plan. You pay cash. Anything that you need to find out about over-the-counter medication, which can include pain medications like Advil, Tylenol, and etc., you can always go to the pharmacy and talk to a pharmacist, and they will direct you as to where those medications are. I think that covers that, right, Luis? Anything to add on that?
Yeah, no, again, something that you don't need a prescription from a medical provider is considered over the counter, and those are not covered by the insurance company. Uh-huh.
Okay, I think,
One last thing.
yeah, absolutely.
If there's ever a situation where there is, because it happens, there's some confusion, there's some maybe IT issues, and it's something that should be covered under the plan, and it should be covered under the plan. But again, at that particular moment, there's IT issues on the back end, with the provider, with yourself, and you just got to, get it done. And if you pay, save your receipts and all that stuff, because you can get reimbursed by the insurance company if that ever happens, so that you don't lose the care or the treatment that you need in that moment. Then you can deal with the insurance company directly after and let them know, hey, there was a problem. I just had to pay because had to get seen, or I needed this medicine right now, and I want to get reimbursed. And how can we go about that process?
Perfect. Luis, do you have a quick email that they can send their questions in? I'll put it in the chat.
KJ, we're trying to keep everything into the portal, if
Okay.
that's okay.
Yeah, that's perfect.
The portal. And again, once you log into your portal, you'll go to messages, new message, and then you'll simply put the student health insurance department. And again, this is secure. This is the fastest way to get a hold of us. And our turnaround time is usually a day or two, but actually at the beginning of the semester and as we're transitioning, it might take a little bit longer. So please be patient with us. We're a small department, but it's on record and we have to respond to you through the portal.
Thank you, Luis. And I'm going to wrap this up quickly here. If you have any more questions, like Luis said, please go through the portal. If you have any questions for us, for our team here at ISSC, you can email us at issc.asu.edu. We do have a Canvas course that we will be sending more information. It gives you all the details of different things that are available to you as graduate incoming students, new incoming students. And I do suggest that you use this QR code for International Student Digital Handbook. It has all the information, including health services and everything else that you need to know. Great tool to have, especially when you're flying that a long trip over here. Use that time to go over this handbook. Great resource. We will have 2 more sessions, general information sessions coming up December 9th, and the other one is on December 16th. And finally, we'll have a live Q&A on December 19th. So please, if you have missed any of those, you can come in and join one of those. And even if you have joined in the past and you want to do it again, you'll feel free to join those sessions. Finally, we did the questions. Thank you for joining us today. Thank you, Luis, and the health insurance team. Thank you for being here and answering all our questions. And we look forward to seeing you at ASU in a few weeks now, or less than a few weeks. Thank you and have a great day.
Thank you, KJ.
Thank you, Luis. Have a great day.